Here's what you need to know about abdominal aortic aneurysms. It's the 15th leading cause of death in the United States. In addition to the risk of rupture, where there's eventual increase in size and rupture risk that can lead to severe bleeding, aortic aneurysms, because of the flow turbulence of blood flowing through an abnormal vessel, it can cause debris and thrombus or clot to form along the edges of the aneurysm, which can then go to your legs and other organs and cause ischemia or lack of blood supply. An abdominal aortic aneurysm develops when the wall of the aorta weakens over time. This can lead to a bulging or ballooning of the blood vessel. Over time, this can be a risk for rupture or for thromboembolism. Rupture meaning the balloon bursts, potentially causing life-threatening bleeding, or developing thromboembolism because some of the flow dynamics and the turbulence of the blood flowing through an abnormal artery cause thrombus or clot to form in the walls of the aneurysm that can then shower or go to different parts of the body, causing ischemia or lack of blood flow. Did you also know that aneurysms tend to run in families? So up to 25% of people who have aortic aneurysms have a family member that has it too. So let's talk about it. Symptoms: no symptoms, pulsatile mass, or severe sudden abdominal or back pain could be signs of a symptomatic aneurysm, either impending or actual ruptured aneurysm, which is a life-threatening emergency. Or discoloration of the feet, something we call blue toe syndrome, where there's some of the clot that forms in the aneurysm sac that then travels to other blood vessels and gets lodged into the smaller arteries and causes blockages. Let's talk about the causes and risks. Older age, hypertension, family history, smoking, atherosclerosis, and chronic lung disease. These are all common risk factors for development of abdominal aortic aneurysms. Diagnosis starts with a physical exam. If somebody has a pulsatile or palpable aorta, usually an aneurysmal aorta in the right body habitus, may be palpable where you press on your belly and you can feel it. And the other diagnostic tools that we use are ultrasound and CT scan. So what is the role of a vascular surgeon in the treatment of abdominal aortic aneurysms? Because we are trained in both open and endovascular techniques, we can look at the CT scan, which is very important in the preoperative planning of these aneurysms, and decide if an endovascular aortic repair is a good option for you, or if an open repair is more reasonable and indicated. In males, any asymptomatic patients without any back pain, thromboembolism that we spoke about, or abdominal pain or rupture. So we're talking about incidental finding or surveillance imaging that shows an aortic aneurysm in males more than 5.5 centimeters. Those aneurysms should be fixed.